Hello, my name is Karen Carter. I am a student at Morehead State University in the nursing program. I have been assigned to complete a movie critique on a healthcare-related film of my choice. This film critique is for the class NURB 461, Nursing Leadership and Management. The film that I have chosen to review is And the Band Played On. This film is a made-for-television movie that was released on HBO in September 1993. The screenplay for the film was adapted from the true story written by San Francisco journalist Randy Shilts. The producer for this film is Aaron Spelling, and Roger Spottiswoode is the director. This film features numerous A-list celebrities. Matthew Modine stars as the epidemiologist Dr. Don Francis. Dr. Francis's character serves as the principal researcher employed for the Center for Disease Control, which is referred to as the CDC for the remainder of this critique. Alan Alda, Ian McKellen, and Lillian Tomlin also have supporting roles in this film. Steve Martin, Phil Collins, Angelica Houston, and Richard Gere also make cameo appearances. This film is an extremely powerful and emotional look into the political and social turmoil that occurred during the time the human immunodeficiency virus, HIV, was discovered in the 1980s. And the Band Played On begins by Dr. Francis traveling to a small African village in Zaire during the Ebola fever outbreak in 1976. Dr. Francis was going to provide support and additional assistance to the physician that was already in the village. On Dr. Francis's arrival, the medical team and many of the village community members were dead. This incident stays with Dr. Francis and is revisited in flashbacks during the remainder of the movie. This introduction demonstrates the human connection that Dr. Francis develops with those that he is trying to help through disease identification, vaccination, and treatment. Fortunately, the Ebola fever epidemic was contained before it was able to spread worldwide. The movie continues over the next 4 years with vignettes of hospitals from around the world faced with treating patients with an unknown disease. The medical community is stumped by the disease presentation and has not quite connected the significance of the illness as it is related to other parts of the country. In 1980, UCLA Hospital identifies a patient with 0 T cells. In 1981, the CDC is notified of the growing number of unexplained deaths in the homosexual population. At this point, the CDC is put at the forefront of the movie, and the focus becomes the research process of discovering the many facets of the unknown disease. The CDC has almost no budget and limited access to equipment, which was mostly outdated. The organization also has several obstacles with other medical professionals and politicians. The CDC went to publish data concerning what they thought was a disease that affected only gay men in America and ended up deleting the phrase gay in hopes that it would not offend the political higher-ups and reduce their chances of gaining access to any federal funding. Research is continuing, and it becomes noted that the bathhouses are heavily connected to the men that have acquired this disease. In an effort to reduce disease transmission, the CDC encourages other political leaders and gay rights activists to support the closure of these establishments. This causes a huge issue in the gay community. Many homosexual men view the bathhouses as a sign of sexual freedom. It is very difficult for them to view losing these places that allow them to be open about their sexuality. The gay community, particularly in San Francisco, become extremely vocal about their lack of support for the closure of these bathhouses. Researchers with the CDC continue to work tirelessly to try to identify the genetic code and the modes of transmission for this unknown disease. They are recognizing more cases, and the mortality rate continues to increase. The disease continues to be labeled gay pneumonia or gay cancer, causing continued negative social stigma. The media that supports gay press continues to refer to the disease as a gay disease, while the non-gay media avoids the subject altogether. There is a growing amount of frustration among the members of the CDC researchers related to their lack of knowledge about the disease. The movie now switches from focusing on the United States to France. French researchers were also working on identifying this disease. They noted an increase in unexplained deaths that affected more than the gay male population. French are finding unexplained infections in men and women, young and old, rich and poor. The only connection among these individuals is that they are of French African descent. The disease is starting to appear as if it has fewer boundaries than what was originally thought by the medical community. Hospitals that are treating these patients become pressured to not care for these patients by the unaffected patrons of the hospital. Back in the United States, Ronald Reagan is elected as president. He has yet to make any public statement about the disease. However, he did announce that there would be a cut in funding related to public health. He was allotting extra money to the defense budget. There would be no additional funding for anything medical illness associated with gay. The CDC continues to work and make slow progress related to disease identification and transmission. They eventually are able to link the disease to sexual transmission. They are also able to determine that the pathogen is transmitted through blood products. The disease can be identified in some patients using the test for hepatitis B. However, the CDC continues to face multiple roadblocks in the medical industry because it takes scientifically based evidence, which takes years to accumulate to prove their theories. There are few political entities and medical industries willing to accept the CDC findings as valid and make expensive changes to their current practices and policies. It is at this time that the FDA rejects the CDC recommendation that blood banks screen their blood for hepatitis B virus prior to administering to any of their patients until further, more specific testing can be developed. The focus for these organizations tend to be financial instead of in the best interests of public health. In 1983, the term acquired immune deficiency syndrome, or AIDS, is used to replace gay-related illness. The French also isolated the retrovirus, which they believe is responsible for the AIDS disease. Public health concerns continue to grow. Nurses quit their jobs instead of taking care of patients with AIDS. First aid classes are canceled for fear of catching and or transmitting the disease via the mannequin. Also, personal protective equipment, PPE, which included CPR mask, was developed and issued to public first responders in the case that they needed to perform CPR or handle any body fluids of a known AIDS patient. The movie ends with a dispute between French and American scientists over who actually discovered the retrovirus that causes AIDS. Dr. Francis intervened and begged the French and American researchers to settle their dispute in the best interest of public health. He was afraid that if the medical discovery got tied up in a court battle, all medical research would stop. This would be devastating to the medical community. The researchers agreed to take joint ownership of discovering the virus. And in 1984, the United States announced that the virus had been isolated and a blood test was expected to be available within the following 6 months. The closing footage of And the Band Played On features a candlelight vigil march in San Francisco. After the march, there was a collection of pictures, video, and news footage of people that were involved with HIV education and research or diagnosed with HIV. The collection was set to Elton John singing The Last Song. I thought this film was extremely well done. It was very effective at delivering several messages related to the development of the discovery of HIV. It showed the political struggle that was encountered at almost every avenue when a new development occurred related to the disease. It also emphasized the social struggle that those with HIV faced. Finally, it showcased what people could accomplish when they worked together in the face of adversity. Thank you.